and welcome again. This is Dr. Naz, and today I'm going to cover with you our second topic in the Endodontics playlist, pulp necrosis. We're going to cover what does it mean, the types, the etiology, how to diagnose it, and also how to treat a tooth that has already died. So, necrosis, as you can see over here, necrosis is the death of a body tissue. It occurs when too little blood flows to the tissue. And then that means that pulp necrosis is when the pulp tissue inside of your tooth dies, meaning the death of cells and tissues in the pulp chamber of a tooth with or without bacterial invasion, which may be the end result of many cases like dental trauma, caries, and irreversible pulpitis that we covered in our last video. Also, you have to differentiate between necrosis and gangrene, since necrosis involves only cell death and gangrene involves the death of an entire organ. So, the stages. Stages of pulpitis, we've got three. The reversible pulpitis that we covered last time, and the tooth can, on this stage, heal on its own if a dentist repairs and seals it. We also have irreversible pulpitis, the second one in the acute one. And in this one, the inflammation progresses and the tooth can't heal on its own, unfortunately, without the help of a dentist. And the pulp necrosis is when the pulp tissue dies. So the infection can also spread beyond the pulp into your jaw. This is when it becomes dangerous. Well, before, when the infection used to spread to the jaws patient, it was deadly in many cases. But now, with the development of medicine and stuff, not as deadly, but it's still dangerous. So, like we said, it can spread into the jaw, the neck, the chest if not treated, and these conditions can be very serious, like I just said. So, as for the etiology, we've got three factors: physical, chemical, and bacterial. Physical, of course, divides into mechanical, thermal, and electrical, as you can see over here. So for the mechanical, it's accidental trauma, iatrogenic dental procedures. For you who don't know what iatrogenic dental procedures mean, like dental iatrogenic treatments can produce injury either on the tooth or the periodontium or both. So this iatrogenic trauma can be defined as any trauma that has been induced by the dentist's activity, manner, or therapy. And this term is generally used for an infection or other complications of treatment. So we also have the fracture of the tooth, pathological wear, as in attrition, abrasion, thermal, heat from cavity preparation. I think it's understood. As for chemical, we've got phosphoric acid, the silicate cement, self-polymerizing auriculic resin that we use, etc., and erosion due to acid. As for bacterial, we've got the invasion of pulp from deep caries, like we covered in our last video, blood-borne microorganisms causing pulpal inflammation, and infection from periodontal ligament space. As for the types of pulp necrosis, we've got two: coagulation necrosis and liquification necrosis. So the coagulation necrosis is caused by ischemia, and the liquification necrosis is caused by an infection. Ischemia is a condition in which the blood flow and there's oxygen is restricted or reduced in a part of the body. So, coagulation necrosis, that is caused by ischemia that I just explained. It means, like we said, like of oxygen and nutrients, which leads to the decline in cell metabolism. Let me show you right over here how cell metabolism works. This is cell metabolism. That I'm pretty sure everyone knows, since it was studied in high school. But if you don't, well, here's a scheme explaining it. So, like this decline in cell metabolism, it can happen for over 4 to 5 days, and then because of that, we've got intracellular enzymes which prevent cell autolysis. Autolysis, more commonly known as self-digestion, refers to the destruction of a cell through the action of its own enzymes. So in coagulation necrosis, the soluble portion of the tissue is precipitated or converted into a solid material. So coagulation of the cytoplasm fixed in a kind of gel. So liquification necrosis, which is caused by a bacterial infection. So if there was an absence of treatment, it's going to cause an inflammatory pulp reaction, which is going to lead to the release of toxic substances and proteolytic enzymes, which is going to lead to the destruction of cells, fibers, vessels, and nerves. It's going to lead to the release of lysosomal enzymes, which is going to lead to the destruction of other cells. So basically, liquefaction necrosis results when proteolytic enzymes convert the tissue into soft mass or liquid. So how is the pulp necrosis diagnosed? We can either diagnose it by an electric pulp testing. In this test, an instrument delivers a small electrical pulse to your tooth. If you can feel the stimulation, your pulp is alive. In pulp necrosis, you won't feel the electrical pulse. So we also have the heat or cold test. This involves touching your teeth with a cold substance, and I may ask you, like the dentist may also ask about the sensitivities you have experienced while eating or drinking. We also have tooth tapping, as you can see over here, meaning the dentist will assess your response to gentle tapping on your tooth with a probe, for example, or dental x-rays, which allow us to see the structure of the patient's teeth and jaw. These images may show defects in the tooth or infected pulp, as you may probably know. So, pulp necrosis, complications. We've got the Ludwig's angina, the mediastinitis, and osteomyelitis of the jaw. So these complications occur when the infection in the pulp spreads, like I told you, with the absence of treatment. If it reaches the tip of the root, it can cause a pocket of pus, an abscess. This can be very painful. Other complications include, like we can see over here, the Ludwig's angina, an infection in the soft tissues under your tongue and in your neck, as you can see over here. And it has to be treated surgically, meaning it has to be removed. We also have the mediastinitis, which is right over here. It's an infection in the space around the organs in your chest. Here it is. See over there. And we also have the osteomyelitis of the jaw. It's an infection of the jawbone. It can be also very painful, and it can lead to teeth loss. So once the pulp tissue dies, your dentist must remove it, right? This will prevent the infection from spreading and causing all these complications that we just spoke about, and causing further damage in general. So options for treatment we've got include root canal treatment. So this can be either performed by a general dentist or an endodontist. We remove the pulp, clean out the root, then fill and seal the empty root canal. After the tooth has had a few weeks to heal, we might usually cap it with a crown. As in for tooth extraction, tooth removal, and right after it, we should replace the tooth with a dental implant or a dental bridge. So in some cases, we may also have to prescribe antibiotics to help prevent the infection from spreading, especially if the patient had to wait for the procedure. But this isn't a primary treatment. So this is a root canal treatment and a tooth extraction. Okay, so I hope you liked today's video, guys. Make sure to share it and subscribe for more videos on endodontics.